Very well, it's now time for our interactive segment, and our focus of discussion is the latest threats that are coming from the Kenya Union of Clinical Officers. They're saying that if the government and the county government do not engage them and complete their agreements in the CBA and in full implementation of the return to work formula, then they're likely to go on the streets. So we just want to find out what really are some of the issues and how can we be able to save our health sector. And for more details of that, joining me now in studio is George Gibore, who is the Secretary General of the Kenya Union of Clinical Officers. George, thank you for joining us this evening.
Thank you very much.
Let's start with what really are the issues that the clinical officers are raising.
I appreciate for this particular time that you have given us at least to highlight on the issues that are affecting clinical officers. And we are saying this is the voice of the disgruntled clinical officers in the country. It is we have historical issues that we have been mentioning, which we wanted to be included on the CBA, whereby the negotiation has stalled. It should be remembered that in 2017 October, on 5th, we entered into a return to work formula, which is an agreement, actually is a legal document. We agreed on a number of issues that was to be done with the timeline, including promotion for our members across the countries and even the national government. There is a clear policy, which is the Public Service Commission policy, which guide on promotion for our members. You will find that the entry point, you are supposed to take 1 year, then subsequently in the next job group you go for 3 years, then now become competitive.
Yes.
That is common cadres. Now the common cadre has been disregarded. Members are staying in one job group at the entry job group for more than 10 years. Now we are, a majority of them 7 years now. And we are asking, this is the policy that has been given by the government, why can't they follow them? These are just purely theirs. We did not make them.
So are you talking about the national government or the county government?
Both of them. Both of them have actually not observed the policy. And that's why we are saying them, we are not selective on the same issue. Then we are saying that there are some other issues that we wanted also to be on the CBA, which we believe that we have already negotiated 90%, only 10% have left. The other issue is payment. So
these are the 10% are not issues that are already contained in the CBA?
There are issues now that the national government did not want to be on the CBA, which we feel are quite pertinent to our members and are already on the other policies. We only want to have how we can be acting on them without much push.
So that means you're introducing something new as opposed to what was in the CBA?
No, this is the first CBA that the union is negotiating. Actually, the union is new. This is the second year of its inception. Yes.
So what is it that you want included besides the promotions that you've talked about?
Besides promotions,
yes.
We have been pushing that the county government has been providing what we call a regular contract for our members. We want to set standard for such a contract. If you are hiring a professional, then that professional should be set that you do not underpay them like casual, because we have a scheme of service and subsequently we have the code that provide for the same. Then you give them this entry point to be their grading and enjoy the same right. The SRC came with what we call that you have to pay equal service for equal work done.
Yes.
No, when you contract someone and give them the name casual and they are providing professional services equivalently to those who are on permanent and pensionable, then you delineate them in a manner that they are casual but offering professional services.
So you have not been recognized as professionals, is that what you're saying?
That's not what I'm saying. I'm saying that they are giving irregular contract, which does not conform to what is the standard. And we are saying that they must be able to look and observe the policy that has already been provided. And that's what we are saying, that it must be penned on our contract, on our CBA, so that we have a standardized level where they must be able to engage. Because some counties start and they're paying them 15,000 and they're offering professional services against what should be. And remember, on contract under the Liberation Act, it provides clearly that people who are on contract, in any case, they should be able to get good term because they don't have
other benefits.
Other benefits.
Okay. In terms of salaries, what is it that you as clinical officers want as the entry level? The grades that you are proposing? If
you may allow me, the entry level currently, they are actually paying. It has been 19,000. It is still 19,000, where they are paying basic salary of 19,000, and some other basic other enjoyment that they normally enjoy, like the risk allowance, which we are asking that they must be reviewed in a manner that to be improved, because we are the people who see patient first in the facility. Most of the time you'll find that this patient who come with the more MDR, that's small drug resistant patient of TB and other conditions which are actually infectious, they see clinician. We have had cases where clinicians die and no one take care of them. So these are the issue we are saying that at least if at all we have to consider, take it fair and give it a normal pay like the other one, because I know that some of them are paid 20,000. We are asking that we gave our proposal for 20,000. The government has not given any proposal. Improvement from that. Actually, we are the least paid on the risk allowance. Then the other allowance we are asking is that we have specialist clinical officers like in anesthesia who have actually go on in theater with the surgeon. A surgeon is getting a call allowance of 70,000 when a clinical officer, anesthetist, who goes in theater the same time and get calls the same time when he getting on only 10,000. It is quite impartial. We are saying that harmonize the salary, because we are not asking for anything to be introduced new. We are saying only do it fair, equalize, observe fairness, and do harmonization of the salary. And of course, the SRC came with what they are doing job evaluation, which actually I think it flopped because it never peaked. We have never seen anything coming from the SRC where they had to come and evaluate what job are you doing so that they can be able to try and bring equity in the pay. The other issue maybe I need to mention so that we are not moving. We are the health provider. As the clinical officer, we are actually at the mercy of ourselves because we pay insurance for ourselves against the Employment Act, which provides that the employer must pay for our insurance. Now, we have been asking, even the SRC gave a circular, asking the government to ensure that they are able to provide a comprehensive cover for these health workers.
Yes.
We cannot, the county government are not willing to do that. However, there are few which have done that, which we feel that still can be able to be improved because it is still not comprehensive, what a comprehensive term in insurance means. So that's one of the things that they don't want it to be entered in the CBA.
So in terms of engagement with the government and the county governments, have you had any meetings?
Yes, we want to say that because we had a negotiation that started in 2017, December, and it went up to April 2018,
Yes.
when now the national government and the county government walked out of the table. We followed the provided laws and the rules. Under the Liberation Act, we appealed through the Ministry of Labor, where they were called for conciliation. They came because the CS for Labor appointed a conciliator.
Yes.
They came once and they again walked out. Now, under the Liberation Act also demands that the CS for Labor ought to have even gone to court to force them to come on the table so that we finalize on the CBA. But now, if you can do that, the CS for Labor also ought to have given us a certificate of dispute not resolved. They have not done that. We have done more than 9 petitions to them without any good response. That's why we are saying we have hit the dead end, and we must result. Tell our members who gave us the mandate to represent them that it has failed, the diplomacy has failed, then we can engage even because the law provides for industrial action. That is what we will be calling now.
So from April 2018, you have not had another meeting with anyone from government, both national and county government?
No, we haven't, because April, that's when it flopped, the discussion flopped. We appealed. Then we had one discussion around May. When they come, then now they walked out totally because they were not willing to continue the negotiation.
So what was their point of contention?
The point of contention are few issues that I have told you that they don't want them to be on the CBA,
with the CBA,
whereby we are saying these the most achievable issues which we want equity and the harmonization of the few things. We are not even asking for any introduction of new things. No.
You are just asking for the promotions and what you've had.
Which are doable.
But in terms of, financing, because the government keeps talking about, the wage bill, do you see them, agreeing to your terms?
I don't know where the issues of money comes in, because one thing that we are talking is that they have failed to come on the table. They give at least their their proposal. They haven't even given their proposal on the few issues that we are talking now about. If they give their proposal and say, this is where we are, then we are negotiating. I think the rules of negotiating is I put my proposal, you bring your proposal, then we discuss on the proposal. Then they have not given their proposal. That is where the goodwill of the government is taken away. Remember, I've said that we signed a return to work formula providing that we had 60 days to enter into an agreement, and that's to sign a CBA, to agree. But when we went out of that time, they requested, we have letters that they requested for extension.
Yes.
When now we extended, that was April, that was around end of now February, we extended up to April. Now when they walked out, that is when we said that, okay, we can still exhaust the other mechanism that is provided in the law, which they have again not actually observed the orders of the conciliator who request them to be on the table.
And so have you thought about moving to the Labor and Relations Court before you go in this direction?
I think that's what I've said, that if you look at the Liberation Act, it provides that the CS
go to
ought
the
to go to court.
Yes.
The CS for labor is permitted to go to court and compel that people who are not willing to be on the table to come on the table and negotiate. Now we have been left.
Which she has not done.
Which he has not done.
Sorry. Yeah.
Yes, that is what we are saying. And again, he has even failed to give us a report or a certificate of dispute not resolved. And that's why even we normally ask the president that he has good agenda for this country. But the people he has put in the office are the people who might not even help him to propel his idea. Now look, if you cannot be able to bring people together and discuss, and even be able to prepare a report and give out, I think that's why we are saying that they have, maybe they are supporting each other, they are to sabotage the discussion. And we are saying that the president must observe, if he wants the universal health coverage to happen in this country, he must be able to observe that the people who are in the office must be able to adhere to agreement with the employees. Now, the simplest of it is that the CS also for health, 9 months down, after even negotiating and agreeing on the recognition agreement, have not penned their signature on the recognition agreement. That is also a beef.
So as of now, they don't recognize you as
the
a
national
union.
Government. Yes, remember that's the reason why people also why we can go on strike under the Liberation Act. It has said if the employer cannot agree into signing of a recognition agreement, then the union can call for a strike.
And the fact that now healthcare has been devolved to the county government. I mean, how practical is it for the national government to want to sign, a recognition agreement with you?
The national government also has employees, has clinical officers who are employees of the national government. Subsequently, the policy matters have been left with the national government. Remember, a CBA is also a policy matter. Now, we have been negotiating under the COG, which is supposed to coordinate the activity or rather issues which are of common agendas at the county level, which include the CBA. I do not expect every county to go and negotiate their CBA individually, because already we have set some precedents on the same, where other unions have gone through the same channel. So if today you say the Union of Kenya Clinical Officers must go and negotiate with the individual county, that will be discriminatory and should not be allowed to thrive. In any case, if we have taken 3 years now to come up even with the only recognition agreement and the CBA has not been realized and we do not know when, then that is to say we will be able to take more than 3 years in every county to negotiate for a CBA. How many years are those to realize a CBA?
And have you tried to approach parliamentarians perhaps to raise your issues?
Thank you for raising that question. We have done petition to the National Assembly and also the Senate. The Senate gave us an invitation. We met. They have never also given their report. That is the Committee on Health. And we have now done again the last one which we have done. I think it should be received there today or yesterday or tomorrow at the Senate now on a committee for labor, so that we have fully exhausted. We will be giving them the chronology of event and what has happened, so that it does not seem that we left any other mechanism that will have helped to resolve this matter. And that is why we are saying the clinical officers outside there, I might be talking even on a soft way, they are feeling disgruntled because they are feeling discriminated by their own employer who cannot afford. Let me tell you, for benefit of doubt, that the national government have selected the lower job group who are now below job group K. They are the one who are not benefiting from now what I have called the comprehensive medical cover, which is actually they are paying the same amount with the higher job group against what is supposed to be. Now, if you have to do that, that's what we call discriminatory. And the majority of our members are below that job group. And that's why they are feeling that they are serving a government that it does not actually recognize and appreciate what they are doing.
In terms of your membership, how many are you under the union?
I want to say that currently we have 20,000 clinical officers in the country. Under the county 47 county government and the national government, they are around 6,000. And we have other people now who are working with the NGOs and or other partners with the government who maybe add up to around 1,000 across all the other counties and the national government. And now currently we have a number of those who have registered both in the both those who are the government and those who are private. We have 14,000 members.
We have 14,000 members.
Yes, who have subscribed to the union.
Okay.
Yes.
In terms of the timing, there are those who are going to argue that, right now we have, the nurses strike.
Yes.
Some counties, nurses are on strike. Others, of course, are saying that the CBA has been implemented and things like that. So in terms of the timing, would you be also trying to ride on, the fact that there's already a health crisis when it comes to the nurses to also just sort of benefit from this?
I think what we are trying to say is that you can look the period that we have given the government to address this issue, despite others even coming on strike and going back. Those since 2017, that is more than 2 years. The government have totally refused. Now that's why we are saying we have given them a grace period to do this. They have failed. We only look for time. Any other person will say, I have to go and pray that I get a baby as you are praying to get your own baby. So we are not trying to say that we are following whichever they are doing. In any case, if that is what will benefit us, I think we should do it like yesterday.
Yes. All right. I'm informed our time is up. But just, looking at the issues that keep cropping up in the health sector, are you one of those people who feel that perhaps we devolved healthcare too soon?
Thank you for asking that question, and I need to maybe address myself to some time when we had a review of the same. We were asking, why have we had this numerous strike under the health sector since devolution? We were at Manzoni. The government was there, both the national government and the county government. We discussed, and this issue that I have mentioned, starting from promotion, employment of more staffs so that we puff up the staffing and ensure that also we are able to do salary harmonization, which is a petition we have done even to the Salary and Renovation Commission.
Yes.
And we also did it through the Transition Authority, during the Transition Authority. Now, those issues, all the issues that we observed are still there, and they have not done anything. And we are saying, even if we run away back to the national government, if the issue is still there, they will not be able, they have not been solved. We still see this strike. And I normally say, only what we need is a central body to coordinate the activity and ensure that the human resource is well observed. And we do not say that now we need to go back to the national government, but we are saying we can establish the Health Service Commission for the health workers, and they be managed at central level, rather than being in the Ministry of Health or being at the county level. Because all the issues that we are complaining, they're cutting across. Because that's why you are saying, why are we complaining to the national government and yet they have employees and they are also suffering, similar to those who are at the county level.
So what are you saying, that if the government between today and Friday doesn't sit down with you, you're going on strike?
Yes.
Or what are you saying?
Yes, we will be making this announcement. I have said that we have called the organ that has given us the mandate to represent them. They will be here in Nairobi on the 16th, and we will be making our pronouncement on the same way, because this is something that has been continuing. We might need 1 day of notice. We might need 7 days as the Labor Relations Act
So as of
demands.
now, you have not given any notice?
Yes, we have not given any notice, but we are putting them on a notice that, and we are sensitizing our member that this is what is coming up. I think any woman who is on labor must prepare to deliver. That's what we are doing.
All right. Thank you, George. Yes. Unfortunately, your time has run out, but we appreciate you coming and shedding shedding light on some of the issues that the clinical officers want addressed. So we appreciate your time.
Thank you very much for having me.
Of course, that is George Gibore, who is the Secretary General for the Kenya Union of Clinical Officers, saying that the clinical officers want the government to come to the table, just pointing out that they have refused to come to the table, and they're saying that they want their issues addressed. And on Friday, they will be having a meeting, and if they resolve to go on strike, then we will know about that on Friday. This is where we put a cap on our perspective, but up next is Business News with Brian Itaba.